Sudden cardiac arrest is a leading cause of death. In the United States alone, it claims more than 340,000 lives each year. That's more than the entire population of cities such as Tampa, Florida, Pittsburgh, Pennsylvania, or Cincinnati, Ohio. It is unpredictable and can strike without warning. Ventricular fibrillation is the most frequent cause of sudden cardiac arrest. This abnormal, chaotic heart rhythm prevents the heart from circulating blood to the rest of the body. A loss of consciousness and breathing will result. If a normal rhythm is not restored within a few minutes, death becomes certain. The vital role of CPR in resuscitation has long been recognized, but CPR is only a temporary solution that maintains a partial flow of oxygenated blood to the brain. The treatment for ventricular fibrillation is defibrillation, an electrical shock delivered through the heart by a device called a defibrillator. Defibrillation can stop ventricular fibrillation and allow the heart to resume pumping with a normal electrical rhythm. Surviving sudden cardiac arrest is often dependent on how fast a patient is defibrillated. For each minute ventricular fibrillation continues, the chance of survival decreases by about 10%. After as little as 10 minutes, very few people are successfully resuscitated. Historically, defibrillation has been provided by EMS personnel. EMS response times from collapse to defibrillation are often longer than 10 minutes. In most cases, it's too late. Technological advances in defibrillator design now make it possible for you to provide defibrillation. Automated external defibrillators, or AEDs, are small, portable, and easy to attach and operate. AEDs contain microprocessors that can accurately identify ventricular fibrillation, so you don't have to. An AED analyzes the heart rhythm, advises you when a shock is indicated, and defibrillates the patient through electrode pads adhered to the patient's chest. With an AED, you have the capability of providing defibrillation much earlier than EMS. AEDs are safe to operate. They will only allow a shock to be delivered when necessary. AEDs are designed so an accidental delivery of a shock is not possible. In the U.S., the chance for surviving a sudden cardiac arrest without an AED is about 5%. By implementing bystander use of AEDs, some AED programs have dramatically improved survival rates as high as 50%. EMS systems still play an essential role in patient survival. Advanced cardiac care stabilizes patients who have been successfully defibrillated and helps prevent rearrest. The chain of survival outlines the most effective response to sudden cardiac arrest. The chain of survival consists of 4 links: early access to EMS, early CPR, early defibrillation, and early advanced care. Any weak link in the chain will reduce a patient's chance of survival. Early defibrillation with an AED has shown to be the link with the most influence on improving the chance of survival from sudden cardiac arrest.
Hey Bill, are we going to have enough books to fill this order today?
We're going to be fine.
Okay, it's really important this order go out by noon today, all right?
Don't worry, I'm on it.
Okay, great, thanks. Hey Greg, how's this new conveyor system working out for you?
Dan, I think we got it just right. The computer's going to control the program so that... Hey Bill! Bill, are you all right? He's not responding. Call 911 and get the defibrillator.
Okay. Yes, hi, I'm at Silverman Industries. I've got an employee who's collapsed on the floor. The address is 990 Owens Loop. He's unconscious, not responsive on the floor. I don't know if he's breathing or not. Yes, we have an AED. Go get it. No, the phone is not portable. Okay. Okay. Here's the defibrillator.
Hey, thanks.
I'm gonna go out and wait for EMS.
All right.
Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
When an AED is available, your initial approach to a collapsed patient remains unchanged. If it is safe, determine whether or not the patient is responsive. Shout at him loudly. Tap his shoulder. If the patient is unresponsive and other providers or bystanders are available, instruct them to activate EMS and get an AED. Establish an open airway and assess breathing. If breathing is absent, provide 2 rescue ventilations and begin CPR. Provide continuous CPR cycles of 30 compressions and 2 rescue ventilations while waiting for an AED. Once an AED arrives, stop CPR and use it immediately. The quicker you can defibrillate, the greater the chance for survival. The most important skill you must learn to effectively operate an AED is how to correctly place defibrillation pads on a patient's chest. Placing pads as accurately as possible allows an AED to deliver the most effective treatment. Defibrillation pads must be applied to a patient's bare chest. Tear or use scissors to remove all patient clothing, including undergarments. If a patient's chest is wet or sweaty, dry the chest so pads will adhere effectively. Use a dressing, towel, or even the patient's own shirt. Defibrillation pads have pictures on them to assist in proper placement. Look carefully at the pictures before placement. Peel the pads from their backing one at a time to place on a patient's chest. Place one pad below a patient's right collarbone, above the nipple, and beside the breastbone. Make sure the pad adheres to the skin by pressing it flat with your hands. Place the other pad lower on a patient's left side, over the ribs, and a few inches below the armpit. Again, press firmly. Placing pads properly and as accurately as possible allows an AED to deliver the most effective treatment. AEDs are designed to be simple to operate. The 4 basic steps to operate an AED are: turn the AED on. Attach it to the patient and allow it to automatically analyze the patient's heart rhythm. Clear yourself and others from the patient when indicated by the AED and press a button to deliver a shock. Begin by positioning the AED next to you, close to the patient's head. Open the case and, if necessary, turn on the power. This will start voice instructions from the AED. Remove the defibrillation pads from their packaging. Bear, prepare, and place the pads on the patient's chest. Most AEDs have pads that are pre-connected. Other AED models require you to plug in a pad connector. An AED will automatically begin to analyze the patient's heart rhythm once it's fully connected. A voice message will tell you the analysis is in progress.
Stay clear of patient. Analyzing heart rhythm.
Movement of the patient can interrupt the analysis. Be certain that no one is touching the patient. A voice message will alert you if a shock is advised.
Shock advised. Stay clear of patient.
The AED will automatically begin charging and will indicate when it is fully charged.
Press the flashing orange button now.
Ensuring everyone, including you, is clear, push the shock button to deliver the shock.
Shock delivered.
Then, without delay, resume chest compressions. Perform continuous CPR cycles of 30 compressions and 2 ventilations unless a voice instruction from the AED directs you to stop. Some patients may require additional shocks. Follow voice instructions as indicated by the AED. Otherwise, continue CPR. Research has confirmed the benefit of uninterrupted CPR after delivering defibrillation shocks. Do not stop CPR unless the patient clearly moves on his own or you are directed to by an EMS provider. When you are turning the patient over to the next level of care, try to provide a brief summary of what happened, including the condition of the patient when found, how long you think they have been down, and the care you provided. AEDs are designed to detect problems during use and guide you through corrective actions. If you get a troubleshooting message, stay calm and follow the AED's voice instructions. If a voice message indicates a problem with the pads,
press pads firmly to patient's bare skin.
There is either an inadequate connection to the AED or the pads are not completely adhered to the patient's skin. Check the pads by pressing firmly on each one, especially around the edges. If a patient's chest is wet, you need to remove the pads and wipe the chest dry. When the chest is dry, apply a new set of pads. If the pads do not stick due to chest hair, pull the pads off quickly to remove some of the adhered chest hair. If needed, quickly shave the chest, and then apply a new set of pads. Another troubleshooting message may tell you that analysis has been interrupted due to patient movement. Stop all sources of patient movement, such as rescue ventilations or chest compressions. If a message indicates the need to replace a battery, there may only be enough energy for a limited number of shocks. If the AED fails to operate, remove the depleted battery and replace it with a new one. There are a few other considerations to keep in mind when using an AED. For example, AEDs can be used in wet environments. It is okay to use an AED when a patient is lying on a wet surface. However, always remove a patient from standing water before using an AED. A defibrillator should never be immersed in water or have water or other fluids spilled on it. When a patient is in a wet environment, remember to dry the chest before attempting to place the pads. AEDs can also be used safely on metal surfaces, such as gratings or stairwells.
Make sure pads do not directly touch any metal surface.
You could encounter a patient with a surgically implanted device in the chest, such as a pacemaker or an automated internal defibrillator. A noticeable lump and surgical scar will be visible on the chest.
Slightly adjust the pad location so pad edges are at least 1 inch away from the implanted device. Before placing pads, use a gloved hand to peel away any medication patches found on a patient's chest and remove any remaining residue. Defibrillating over medication patches can reduce the effectiveness of the shock. Children are far less likely than adults to experience sudden cardiac arrest. Most AEDs have specially designed features which reduce the defibrillation energy to a level more appropriate for children 8 years old and younger. If an available AED is not specifically equipped for use on a child, an AED designed for adults can be used instead. Keep in mind, the majority of cardiac arrest cases involving children are caused by problems with the airway or breathing. In most cases, children will benefit more from well-performed CPR than defibrillation. If emergency oxygen is being used during resuscitation, direct the delivery device or mask away from the patient when delivering a shock. Some AEDs are fully automatic and do not require a shock button to deliver a shock. To avoid accidental shock to you and others with fully automatic AEDs, ensure no one is in contact with the patient before delivery of a shock.